I warmly welcome you, dear viewers, to our health television. It's nice to have you tune in again. Our topic today is osteoporosis. Maybe you're not directly affected by it, but most of the time, at least one person in the family or circle of friends has received such a diagnosis before. But what does such a diagnosis actually mean, and can something be done about it? I'm therefore delighted to have my guest Alexandra Kottaus with me today. She is here with me. She's the head physician of the Biomed Center Sonnenberg, and she is also a specialist in general medicine, psychiatry, and psychotherapy. And with her, I would like to delve into this exciting topic today. I warmly invite you to accompany me through the conversation. We'll start shortly. Hello, dear Alexandra. Welcome. It's great to have you here.
Thank you very much.
I always look forward to our conversations because your Biomed Center in Sonnenberg, you have really therapy methods and approaches that are as natural as possible and close to the body's needs, and of course very cause-oriented as well. So not just covering up symptoms, but simply giving the body a means of self-help so that it can return to regulation on its own. And today our topic is osteoporosis. It doesn't affect a very large part of our population group, but I have actually received the recommendation to get examined myself. First, perhaps we should briefly clarify the term, what is osteoporosis?
Well, if you were to translate the word directly, it would mean porous bone. That actually sums it up quite well, and it is understood to mean when now during an X-ray, or there are special X-ray techniques for this, a low calcium content of the bone is detected. Okay. That's almost everything.
Yes, exactly.
No, of course not. Yes, what exactly is osteoporosis? I don't even know if science can really answer the question because it's always presented as if it's a calcium deficiency. But the decalcified bone is not primarily a calcium deficiency or calcium deficiency disease. But that's often how it's treated, by giving calcium with the idea that it could then end up in the bone. And we actually know by now that it's not that simple. I also like to say our body is not a car. If there's a lack of oil, I pour in oil. That's just not how it works with calcium and bones. Hormones also play a role in it, and vitamin D, of course. Again, my recommendation is not to pour it down one's throat by the liter, which is becoming more common, but to keep it within a reasonable range. The next thing that is already relatively well known is K2, so that the calcium isn't just absorbed. That's where the metabolism starts. So it's not just a matter of pouring calcium in at the top and it arrives somehow. It has to be absorbed. It has a certain concentration or range in the blood that needs to be maintained. Otherwise, we also have other bodily functions that don't work well. And from the blood, it somehow needs to get into the bone. K2 is also helpful in that regard, as many people already know, and therefore take the 3 K2 mixtures. I mostly don't, that I recommend it.
Okay.
I have to say there might have been a bit of naivety in the organic scene as well, thinking somehow K2 would have no effect on blood clotting. But all K vitamins also produce blood clotting factors. And about K2, it actually hasn't been out for that long, as far as I know, only since last year, that K2 also produces blood clotting factors. I always say a little bit teasingly maybe, usually nothing happens because the people who take it tend to pay a bit more attention to their health or usually take a few more OPCs or something like that. And then there's no thrombosis. But you can make it easier or safer by simply eating a lot of green leafy vegetables and not too little of it. Then there are the advocates, TCM Ayurveda style, who don't necessarily find it so great. But can you also take it as freshly squeezed juice or a smoothie? Yes, but I think those are misunderstood interpretations of these Asian healing practices. Because even a smoothie is basically already pre-digested. And in the West, we sometimes think that to feed the spleen, we need to eat something warm in the morning. But what might be meant by warm in Asia is the energetic quality of the food and not the actual temperature. And the other thing is, I spoke with a TCM doctor, exactly, a healer.
TCM Arzt, genau genommen, mich Heiler unterhalten.
He then said, well, that doesn't mean the Central European overcooked kind either.
Sorry for the brief interruption, dear viewers, but you will soon see a small excerpt from a very special broadcast. And if that excites you, then click on the corresponding link on YouTube below and watch the entire program. Enjoy and goodbye, everyone.
Medicine is causally involved in the existence of chronic diseases. That is exactly what I criticize this medicine for. It rarely asks why someone became sick consistently. Why does someone have these symptoms? Why does someone need a new organ? And can we perhaps change our medicine so that it requires less organ transplantation? Humans are treated like machines. And I believe it. Figures increasingly show it is deadly.
Yes, but he understands it as 30 seconds in the walk, that the vitamins and enzymes are still active. I'm like, hey, I can get on board with that. And I have also once spoken with an Ayurvedic doctor who said that salad is the worst thing you can eat. And I think salad is really the best thing you can eat. Sorry, salad in my definition is greens, raw greens, because the leaf is closest to our cell. And also the substances that are in the leaf we need in the body. That starts with the cell membrane of the leaf and the fatty acids in it. The chlorophyll is often reflected in our body. But in the leaf, I also have flavonoids and carotenoids and trace elements and proteins and fats, enzymes and calcium.
Und Calcium?
And I make myself alkaline with it and thus do not necessarily dissolve the calcium from the bone.
Unbedingt das Calcium aus dem Knochen.
And there we would already have a reason.
Bei einem Grund.
If you are constantly too alkaline, then calcium is dissolved from the bone to buffer the acid.
Gelöst, die Säure zu puffern.
And you also know that if you take proton pump inhibitors for a long time, like pantoprazole, esomeprazole, Nexium, it can sooner or later also lead to osteoporosis.
Dass es früher oder später auch zur Osteoporose führen kann.
You also absorb other nutrients less well due to the changed stomach pH, which also plays a role.
Was auch eine Rolle spielt.
So acid-base balance plays a role. We can say again, oh, the kidney is a very essential component in the regulation of the acid-base balance. The stomach steps in to become acid-free when we are simply over-acidic.
Wir einfach übersäuert sind.
In Chinese medicine, the kidney is also associated with the bones. It is a meridian system.
Meridiansystem. Und
Then those who are, so to speak, a TCM kidney type are often also poorer detoxifiers.
Entgifter.
Or at least if they excrete acids poorly, these people are then also more at risk of developing osteoporosis later on.
Okay. Und
Yes, you can already see, I can go from one thing to another, as they say.
Yes, but that's all very exciting.
also Säurebasenhaushalt und da spielen eben Mineralien eine Rolle und nicht nur Calcium alleine. Und wenn man jetzt Calcium auch je nach Form oder als Zubereitung und nicht in natürlichem Verbund zu sich nimmt, dann kann auch sein, dass man sich damit keinen Gefallen tut. Auch das Blut hat immer einen bestimmten Calciumbereich, sonst kann ich auch mal
Potentially develop arrhythmia or muscle tremors. That's just not necessarily sensible. And that is also regulated by several hormones. Parathyroid hormone also plays a role, not just vitamin D or D3, which is also fully activated in the kidney. And that means we have a biochemical connection, not just a meridian between the kidney and bones.
So the average person is completely overwhelmed. Deciding something like that on your own, what should I do now? Because there's so many interactions as you just described. One person says this, another says that. And then I think I am now with someone who is supposedly well versed in TCM. And then I get a recommendation where you now say, maybe not like that, but perhaps better this way. Not maybe, but better this way.
So, dear viewers, we also sat together briefly beforehand, and I have to say that's the topic for the next show. How do I talk to my body? What does it really want?
Yes, right. So that would be the ideal case, of course.
That would be the ideal case if you are really able to understand your body's language.
Exactly what I mean by that is I simply need someone like you, in quotes, who really demystifies various myths for me.
Diverse Mythen auch entmystifiziert oder
clear them up, like the idea that I need to drink milk.
Ich müsste Milch trinken, damit.
Oh, the milk, that's so far away in my mind.
Yes, that's still in people's minds.
I didn't even consider that. True. Yes, so milk has at best a neutral calcium balance. So I can't refuel the bone with milk. Also, a large study conducted in the Netherlands shows that women who consume a lot of dairy products, drink a lot of milk, eat cheese, particularly after menopause, have significantly more pathological fractures. And this pathological fracture means that you have a bone fracture without having a proper trauma beforehand, like a fall or accident, but simply with minor injuries, and then the bone breaks. And this even occurs more frequently if you consume a lot of dairy products. It's not the best source because cheese contains protein, which also increases acid load, and then it's detached again. And there's still this thinking that if I pour calcium in the top, it could end up in the bone. But there are indeed many steps in between.
Yeah.
Well, it was similar for me. I mean, what does it mean? It was similar for me, but I also had a wrist fracture, but that had to happen with the stupid fall I had there.
Das musste so kommen bei dem blöden Sturz, den ich da hatte.
So that I wouldn't attribute it to the fact that the bone was already brittle, but then, well, my doctor, who was very good, I'm very grateful to him because he told me a really great sentence. I had never broken anything before. And in the situation, I always thought, will it ever be again?
Wird es jemals wieder, ne?
That's complaining on a high level. Other people have completely different problems. And he said, oh, you wouldn't believe what the body can do.
Yes, exactly.
That's what he told me, and that gave me so much courage and made me so confident. But he also naturally said maybe it was out of a sense of responsibility. Let's take a look. Let's do a bone density measurement so that we are on the safe side, so we don't increasingly have problems with it. And the earlier we start doing something about it, the better. However, I decided against it because I had the impression my body doesn't want it.
Yes, that is also a certain radiation exposure. The measurement?
Yes, so I also thought, someone said again, it's quite minimal, whatever. So you do see it again, rather, where one might say, better to avoid such radiation exposure if it isn't necessary.
No, I'm not necessarily, well, let's say if I myself, I wouldn't do it for myself.
Ich würde es für mich selber nicht tun. Ja, also entweder
Well, I would personally wait until the pathological fracture occurs. Because A, I don't want the examination myself, but that doesn't mean that I generally advise against it. Rather, I think it's more of a case-by-case decision. It can definitely be sensible. It might also be sensible if the mother had it or the sister has it, and they have perhaps already had a pathological fracture, which can sometimes be in an unfavorable place. And that can, of course, also be painful, and then you can certainly weigh things up. If there is a legitimate concern, or perhaps one is a kidney type and knows they have been acidic for a long time in life or something, then I don't want to categorically say that's nonsense. Please don't understand it that way. And then there's a certain need for action, of course. But many things are really just case-by-case decisions for me. I don't have a general yes or no to that. Why would I want to delay it or not do it for myself? Because I would already consider what consequence that has for me. Well, for myself, I can say I already do many of the things anyway that I would recommend as osteoporosis prophylaxis, or if you have it, because I also know for myself, I already know that I have had and still have a rather active life, and certainly need to watch my acid-base balance, even if I don't consume dairy products and love greens. It's still not everything, but I also have my things that I take care of my kidneys, and I myself am not on the also great metabolic side.
Ich selbst bin auch nicht auf der so tollen Stoffwechselseite.
There are always people who think I can speak well and so on. But I myself am not such a good detoxifier, and can also tell a litany of what I have been through. And therefore I do take care of my kidneys. But I can say, because of the condition I have, I couldn't take the alternatives offered by conventional medicine anyway.
Alternativen sowieso nicht zu mir nehmen.
I can also say I know I need to take care of my bones, but I never had. I have no choice. I simply wouldn't be able to tolerate or metabolize it. And I can save myself the radiological examination. I mean, if push comes to shove, then I will have a fracture. I'll have to see how I cope with that. But I'm aware of it, and I try to take preventive measures. That's how I would put it. But it's not necessarily that I would say, hey, it's certainly necessary for all people to take preventive measures nowadays.
That is fundamentally necessary for long-term health maintenance, that you simply preventively, that you already look when I am doing well, that you also take good care of the body.
Yes, or even when you're not doing well, even now, a busy life. But I also have my things that I do for myself. It's not that I neglect my body, even if I might sometimes take it easier.
Yes, that's just what I was going to say. You ultimately have stress in your job too. And stress also makes you sour.
Stress also makes you sour, no question. And then I make sure that I work in various ways, not just with greens, but also that I regularly really get my vagus nerve activated, that I control that as well. And I also have my infrared mat at home. That's actually something I recommend. And the infrared mat is simply something that is really used. I know many people who have an infrared sauna and they like it too. But the infrared mat is just easier to use. And most people really love it dearly.
Infrared mat, okay.
Or mixed with a magnetic field. And these are really things that can also help a lot. And the infrared, it goes right to the bones.
Bis auf die Knochen.
These red light to infrared frequencies, they also help stimulate collagen. And that actually brings us to the next crucial point. I said it like that, it's portrayed as a calcium deficiency in the bone. And I had an anatomy professor, we were sitting in the lecture hall, and he had prepared 2 femur bones. From one bone, he completely dissolved the calcium, and from the other bone, he dissolved everything and left the calcium. To demonstrate to us how a bone is really composed. And I must say, I'm incredibly grateful to him for that, because I don't know if I would have realized it otherwise. He passed one bone around and allowed us to only look at the other bone. And now, guess which one he passed around?
So from one, the calcium was dissolved, and from the other, the calcium weight.
So one was just calcium, and the other was completely decalcified bone.
Well, then he let the decalcified one be passed around?
Yes. Why? Because nothing can break.
Yes, that's true.
Because it was a rubber baton. It was almost like an elastic rubber baton. And the calcium, just pure calcium bone, because it would have crumbled upon touching. And now explain to me logically why a decalcified bone breaks in the body.
You really can't.
So the bone matrix must be disturbed, so the bone can't properly store calcium anymore. That has to do with bone formation and resorption. So a bone is not just calcium, but it has a connective tissue matrix where the calcium is held. And there are also cells in it, osteoblasts and osteoclasts. So bone resorbing and bone forming cells. So the whole thing is a bit more complicated than just a decalcified bone.
Entkalkter Knochen.
Okay.
And that's something I measure.
Das messe ich.
You can measure it in the blood, the activity of bone resorption.
Des Knochenabbaus.
But this is not osteoporosis diagnostics.
Diagnostik.
I can only measure the activity of the bone's metabolism. But I can't determine the bone's status quo, how decalcified it is right now. But if I have a patient who comes in with a fresh diagnosis of osteoporosis, then we do this. And then I can say, okay, there's not much activity now. That means at the moment we have time. The whole thing might already be older or even a few years old. So we now have the room to maneuver, to start a treatment and check it later. And then the bone density measurement can be done again to really check the success.
Wirklich überprüfen.
Measure. Do. Measure.
Yes, of course, you have to do it. But what I also keep experiencing is that women, it's mostly women, are made incredibly afraid.
Unglaublich Angst gemacht wird. Ja?
Well, I sometimes feel like with osteoporosis, there's so much fear being created, as if you're getting a cancer diagnosis, as if you have to die from it, and definitely have to suffer fractures, and that it's terrible with lots of pain. I don't even know how many women are walking around never knowing they have osteoporosis. I don't want to downplay it now, but I just want to try to put it into some kind of proper perspective.
Aber also ich will es nur so ein bisschen versuchen, in so eine Art richtiges Verhältnis zu setzen.
It's not desirable to have osteoporosis, but it's also not a death sentence, or necessarily means that something has to happen and that you have to be in pain. That's not it either. And I know cases where the bone has rebuilt itself. Yes, just to make that very clear. And you can do something about it yourself. There are particular other cases. If someone now has another underlying condition and therefore has to take a lot of cortisone or another debilitating illness and the bone is really highly at risk, I don't want to say that in such very specific individual cases, it might not make sense to take not just calcium and vitamin D, but other conventional medical medications.
Jetzt nicht Calcium und Vitamin D, sondern andere schulmedizinische Medikamente einzunehmen.
But like I said, that's not a clear yes or no. Then very special cases, individual decisions. But for what most people have, without it being triggered by another specific condition or medications, one can really, or should even try, in my opinion, to get one's foot in the door in a different way.
Versuchen, den Fuß anders in die Tür zu kriegen.
Okay, so to just go over that briefly.
Das noch mal kurz aufzugreifen.
What you just said, because I find that an important aspect. I've heard someone say before the diagnosis is the worst disease. If that's just found out and I didn't previously have anything missing. We can very quickly set a nocebo. A nocebo cannot be set quickly. So a bad expectation that then results from it and is then nourished by our fears, apprehensions, and can potentially manifest something that might not even be there yet or not yet in that urgency or manifestation.
In der Dringlichkeit oder in der Ausprägung da ist.
Exactly. Infrared MET, you mentioned, that's already something.
Magnetic field. These are things that help, but also everything that supports the kidneys. Okay. It's not like I'm not on the turn proteins, but I have more and more women in menopause or even over 80. Oh, I need proteins. Proteins, where do I get my proteins from? Hey, hello people. Stop. I know this is quite uncommon at the moment, but you really have to delve deeper into the subject matter. Proteins consist of amino acids. That makes it acidic. It is difficult to metabolize. 70 years ago, people didn't eat these amounts of protein, and you need certain things. Yes, even an amino acid like lysine helps build collagen. But that doesn't mean that you have to eat God knows how much protein in huge amounts. Not at all. Also, you also have proteins in greens. I like to emphasize that. Again, elephants and giraffes and chimpanzees and horses and cows, milk horses, can make very, very large bones from that. We are not quite as big, and we don't just have to eat greens. We have a slightly different digestive tract, but in terms of the digestive tract, we are more on the plant-based side. And it's not that difficult to get enough protein. But now, this protein craze, it's just a craze for me. It's not good in the long run, and the bones aren't happy about it either.
Yes, it is mainly women who are affected, I believe, by osteoporosis. There are very few men, and that probably has a different background. It often occurs or appears in connection with menopause, so it's a hormonal issue. Do you also work with hormones?
Well, I would rather not. I must honestly say, it really repels me quite a bit. And most women agree with me. If you look at how many women have osteoporosis after menopause compared to how many women don't have osteoporosis after menopause, then osteoporosis can't be primarily hormone dependent, because over 80% of women after menopause don't have osteoporosis.
Über 80% der Frauen nach der Menopause keine Osteoporose haben.
I think it's 85%. I believe I once calculated it. So, yes, there's some kind of connection,
Irgendeinen Zusammenhang gibt's da.
but there's something within me that absolutely resists working with bioidentical estrogens. And on the other hand, maybe going a little on the progesterone route with natural things, chaste tree or wild yam root, I'd still be up for that.
Da wäre ich noch für zu haben.
But also just, hey, by the way, bones also need vitamin C. And they need not only calcium, but also magnesium and zinc and other trace elements. And that's another trend I've been observing in the last 1 or 2 years, as if we have an unlikely wear of trace elements. You can also argue that the other way around, our food is getting worse, but I think we all have plenty of stresses that are generally not getting any less at the moment in many ways.
In vielerlei Hinsicht.
That we also have quite a mineral deficiency that also helps to break down the bones. Now, I've lost my train of thought a bit. Never mind.
Unfortunately, we've already reached the end of the show. Exercise must also be included.
The bone must be used.
Yes, true. Because everything the body doesn't use, or what we don't use in the body.
And silicon should also be included, actually. And that also closes the circle a bit to the kidney. Nettle and horsetail are kidney remedies, but they are also silicon-rich remedies.
But they are all natural substances?
Yes.
That you are listing now. That's very nice. I find that very nice too. Prefer everything that is natural against, as they always say, there is a remedy for every disease. And we probably just have to re-establish the knowledge. And then we will also get back on track quite well in a natural way. Okay, then I'll say thank you very much for this enlightening conversation and for dispelling 1 or 2 myths like milk and calcium, etc. And especially about the bone structure, etc. Was very exciting. Many thanks. I am already looking forward to further conversations, especially about the body. Am I not always the way I want? We have planned that next. Or maybe sometimes has a different need. And that's good to listen to the body too, because we have to form a good unit. Thank you very much.
Thank you.
Thank you also, dear viewers. I wish you, on behalf of my guest, health for body, mind and soul. Stay mindful, alert and loving to yourself and to your bones in this sense. And feel free to tune in again next time if you like. I would be delighted. Until then, goodbye.
Thank you very much for watching from Swiss Health Television QS24. Please also go to Wikisana, register there and watch all these programs without advertising interruptions. And please also subscribe to this YouTube channel. This not only helps us, but also the further distribution of our channel. Here is a selection compiled for you. Have fun, all the best, until another time. Goodbye, everyone.